How does Müllerian duct fusion from the uterus? Imagine the tiny beginnings of a woman's reproductive system during fetal development. The process that forms the uterus starts with two small structures called Müllerian ducts, also known as paramesomphric ducts. These ducts develop on each side of the embryo separately, from the tissue lining the early embryo called the coelomic epithelium. As the embryo grows, these ducts elongate along the front-to-back axis, running parallel to the Wolffian ducts, which are involved in male reproductive development. In female embryos, the absence of anti-Müllerian hormone and testosterone allows these ducts to continue developing into female reproductive organs, including the uterus, fallopian tubes, and upper part of the vagina. The key step in forming the uterus is the fusion of these two Müllerian ducts in the lower, or caudal, part of the embryo. This fusion creates a single, continuous uterovaginal canal that will eventually develop into the uterus and upper vagina. After the ducts fuse, the tissue between them, called the septum, needs to be resorbed or broken down. This resorption process is crucial because it results in a single, unified uterine cavity. If the fusion of the ducts is incomplete or the septum is not fully resorbed, it can lead to uterine abnormalities such as a bicornuate uterus, where the uterus has two horns, or a septate uterus, where a fibrous or muscular septum divides the uterine cavity. By around 9 weeks of gestation, the two Müllerian ducts have begun to fuse, forming the primitive structure of the uterus and fallopian tubes. By about 13 weeks, the fetal reproductive system takes on a shape similar to that of an adult, with a clearly defined uterine lumen lined by specialized epithelial cells. This process is essential because the shape and structure of the uterus directly influence fertility. Abnormalities in fusion or resorption can cause issues like miscarriage, preterm birth, or infertility. For example, a septate uterus, caused by incomplete resorption of the septum, is linked to higher miscarriage rates, while a bicornuate uterus, resulting from incomplete fusion, can also impact pregnancy outcomes. Understanding how the uterus forms helps us appreciate the importance of normal development for reproductive health. Disruptions in this process can be detected through imaging techniques like ultrasound or MRI, and they are often addressed through surgical procedures to improve fertility. It is also worth noting that conditions like endometriosis, where tissue similar to uterine lining grows outside the uterus, may sometimes coexist with uterine anomalies, although the relationship is complex and still being studied. Always remember, if you have concerns about uterine development or fertility, consulting a healthcare professional is the best step. They can provide personalized advice based on individual medical history and help guide appropriate treatment options.